Okay. How do you want me, doctor, to present you? I know you worked in the military and you're also an orthopedic surgeon. How would you like your presentation to be made?
Well, as far as the military, I retired from the reserve, so I'm not doing that anymore. I am a traveling part-time surgeon in the United States, mostly working in rural communities or communities that have a critical need for an orthopedic surgeon. So I've worked, the last 2-3 years, I worked in Colorado, West Virginia, also worked in Arizona, Indiana, Michigan, North Dakota. So my fellowship was in sports medicine, but I don't really do that much of sports medicine anymore. I basically do general orthopedics, but my passion is really on health optimization. And the realization that most of what I see are due to chronic diseases that are preventable and in many cases reversible too. So I could be introduced as basically a general orthopedic surgeon with a passion for health optimization to truly improve the musculoskeletal health of patients.
Very nice to have you, Dr. Carlos Mora.
Thank you.
I'm very thrilled to have this interview because of being in the presence of a medical doctor, actually a surgeon orthopedic, that talks and puts the accent on nutrition and metabolic function is, for me, how can I say this, a mind-blowing event, because I know many doctors, especially from Romania, where we're from, and does not have this approach. And I really believe this interview will help some, especially the young ones.
Yeah, thank you for having me. I'm very glad and excited to be here.
Thank you, Dr. Mora. So when I was a vegan, I would find myself pretty much not having energy, even not having energy to stand up straight. And I would force myself, and it would take tremendous energy just to stand up straight. Can we say, and I would do sports, and I would do regularly sports. What is your opinion regarding, vegan diet and not having that energy to just stand up straight with no energy, in my case?
Yeah, I think a vegan diet, it can certainly be better than your standard Western diet, but pretty much any diet that gets studied can be better than a standard Western diet. But I do think that vegan diets is sort of like swimming against the current in terms of having to fight to get the proper nutrition that they need, particularly for when it comes to protein and vitamin B12. I think vegans probably definitely need to supplement some B12, and they really need to plan their diets well in order to just get an adequate amount of protein. And I feel like that's something that gets missed. And but studies are coming out on how when it comes to bone health, the vegans don't do as well. Vegetarians do better than the vegans, and those that have an omnivorous diet, that includes meat and other source of animal protein, just are the ones who do the best when it comes to bone health. Also, I think vegans diet could have a lot of these substances that are called lectins that can induce inflammation in the gut, and they could also lead to autoimmune disorders. And so I think, vegans, I don't find it to be an optimal diet, or not even close to it. I do think that those people who might see an improvement on it, at least temporarily, might just be simply by the elimination of highly processed foods, rather than some inherent quality of the vegan diet.
Because most of the vegans, and again, I was one for several years, eat processed food, a lot of processed cereals, and substances like lectins are present in the body, but also refined carbohydrates. And the challenge is that we here in Romania, we have winter, we have autumn, so vegetables and fruits are not particularly just in the warm season, obviously. And what would be your advice to vegans that, you know, do it anyhow, but don't have many opportunities since the season doesn't help, not here?
I think advice to vegans who want to continue to eat in a vegan diet is first to try to eliminate highly processed foods, because I think that's the most beneficial change anybody can make in their diet, whether they're eating, you know, a plant-based diet or eating an animal-based diet. Is the elimination of highly processed foods. In terms of lectins, you know, to perhaps, you know, they're eating legumes or beans, to at least pressure cook them to try to eliminate the lectins as much as possible, or eat the fruits that are in season, and to try to supplement with nutrients such as just protein or vitamin B12. There are other ones that probably they're not getting to, or they're not making optimally, like carnitine, carnosine, but you know, so it's probably interesting to see if they could actually supplement in some other ones. But I think the primary advice would be to eliminate the highly processed foods and to try to obtain adequate amount of protein. And I think they have to supplement B12, because I just don't think that they're going to be able to get enough B12 through a vegan diet. The other thing to consider is, you know, mollusks, you know, or bivalves animals are, it's debatable whether they even have a central nervous system, or whether they even have they suffer pain. So if they're vegans for like ethical reasons and not trying to cause pain to animals, they could actually consider eating some bivalves, which may not have a central nervous system, may not, and it's, you know, it's thought that maybe they don't suffer any pain. So from that respect, they can still get, you know, omega-3, so they can get some of the nutrients that they can get out of an animal-based diet, you know, without having to eat, you know, beef or chicken or something similar.
Because our challenge, if you want to take the fruits and vegetables in their season, is, since autumn and winter is pretty harsh here, we need to order avocado and coconut and kale and other vegetables that would travel half a planet, half a globe until here. Personally, I don't believe it's the right choice. What would be your opinion regarding this superfood or real superfood that travel all around the world until it's here in Romania?
Yeah, Dr. Stephen Gundry, who's the author of the Plant Paradox, talks about that, and the fact that the farther away the fruit comes from or the vegetable comes from, the more likely then they are to have lectins on them. So, I mean, I think that's one argument for having an animal-based diet, because, you know, fruits and vegetables are not going to be available locally year-round. But if one chooses that pathway of only eating fruits and vegetables, they can try to import them from countries that are not so far away, so that the fruit is not harvested as green as it would be if it were coming from the other side of the globe. The other thing will be to consider just the cooking methods. Some of the lectins, you know, will survive cooking methods unless you actually pressure cook them. I personally eat avocados, and sometimes I think some of my avocados come from another country, but I haven't found that to be a problem for me though. And so I think it has to do with at least sourcing it from countries that are not from so far away, because if the greener they harvest the fruits and vegetables, the more lectins they're going to have. And the process of ripening outside of the tree, or at least according to Dr. Gundry, doesn't necessarily remove the lectins from the fruit or the vegetable. So if they cannot be sourced locally, then at least maybe from a country that is not so far away, so that the fruit or the vegetable, when it's harvested, is not as green as if it were coming from the opposite end of the globe.
I was in Italy and Greece, and these two countries are my favorite ones because of the quality food, and their vegetables and fruits are much, much better than our own vegetables and fruits here in Romania. And I'm not talking about bio ones. So the organic fruits and vegetables here in Romania are worse quality than the non-organic vegetables and fruits in Greece and Italy. Do you have any information regarding this contaminated foods, vegetables, fruits, and?
I really don't. In terms of Europe, I can tell you, at least in the United States here, you know, I find that in social media that a lot of people tend to mention, I can go to Europe and they can eat the food that Europeans eat and the people feel fine. And they come back to the United States and they just start feeling sick again. And I think, at least for us, a main problem may be the use of glyphosate as a herbicide in foods. And I think, I don't know the details about this, but I think at least in the European Union, there are some restrictions or heavy restrictions into the use of glyphosate, which is a compound in Roundup, which is used as a herbicide. But in here, it's ubiquitous. And they have found that they've tested the urine of Americans, and about 80 to 90% of Americans can have traces of glyphosate in their system. So I think, I'm not sure how bad the organic food might be in Romania, or non-organic, but in here, I think anecdotally seems to be a problem, because it's very common to hear people saying that when they eat food abroad, they feel fine, and when they eat food here, they start getting sick. In addition, is that we have a lot of immigrants from various countries here in the United States, and when they come here, they start getting like American diseases, obesity, heart disease, type 2 diabetes. And so I do think that it has something to do with the food. And I do think that the use of glyphosate is probably the most important factor here. But I don't really have much knowledge or experience regarding, the European food, organic versus non-organic, though.
We have, so Romania being really poor, we know as citizens of this country that we receive very bad quality of fruits and vegetables. There's no secret. This is very clear. And we usually have overuse of pesticides here. If we follow the right accounts, actually official authorities confirm this. So as a conclusion, if we try to be vegan and still try to do our best, is it right to say that we will definitely have some physical consequences along with our muscle mass, bones, joints?
I do think so. There are quite a few observational studies, and even one that just came out like yesterday, today, that I still have to read it, discussing the problems with the bone in the plant-based diets. But from the observational studies that have been published, the problem with bone density, with a decreasing bone density, it seems to be particularly on the vegans, not even so much the vegetarians. I think the vegetarians are able to keep an adequate bone density mass. Probably, I still think it's better to be omnivorous and to actually eat meat and so forth. But the vegans seem to consistently have decreased bone density long term. They heal wounds more slowly, like surgical wounds or any traumatic kind of wound. And I have not seen studies talking about sarcopenia, but I think my observation of others too has been that they can also struggle with sarcopenia, which is the loss of muscle mass that occurs with aging. And sarcopenia and frailty are very highly correlated with death. And as an orthopedic surgeon, I see that. We see frail people who, just fall very easily. They fall down, they fracture their hip. And even if the surgery goes well and I fix the hip and they can put whatever weight they want on that leg, their other chronic medical conditions tend to kind of spiral downward. And the mortality of somebody with a hip fracture from a fragility hip fracture is about 30% in 1 year. Now, these numbers can vary. Some studies may talk as high as like 50%, but I think the overall average is about 30% of those patients die within a year. And so, at least for orthopedics, it's a real problem. The issue of decreased bone density, osteopenia, or more severe osteoporosis, and the issue of sarcopenia. Now, osteoporosis does get a lot of talk, and of course, and I think it gets a lot of talk because of their medications for it. So if there's a medication for something, then the diagnosis gets discussed. If there's no medication for a diagnosis, guess what? That diagnosis never gets discussed. So the word sarcopenia, although I really think it's a big problem, it's rarely used in the medical field. I'm not sure that I've ever encountered a medical record of a patient stating that they have sarcopenia, because it's not something that we treat with a medication. You do have to do some resistance training, but it is a problem. It is definitely a problem, and it tends to go hand in hand with osteoporosis. And I do think that vegans are higher at risk for these two conditions more than any other dietary group.
What about pills, if you're comfortable talking about the subject? Does antidepressive pills, contraceptive pills, anti-inflammatory pills, and others, antibiotics, because Romanians use loads of these pills, does this have consequences to our muscle mass, bones, joints, and our development?
Certainly, a lot of those that you mentioned, yes. And we could probably go one by one. So the antipsychotics or any kind of neurotropic or psychotropics, they're bad for bone health. And long term, they will lead to just decreased bone health. And I recently had a patient who, with a history of schizophrenia, who was on psychotropics for many years. And, she was only in her 40s, but yeah, she sustained a simple fracture from a standing height and had a comminuted fracture of her tibia. And this is the kind of fracture that I would expect on somebody who's like 85 years old, not somebody who's in their 40s. The bone was very osteopenic, and by comminuted fracture, I mean the fracture was in many pieces. Okay, so it's not just like a clean break, it was many pieces. And I certainly, the only risk factor that I could see is the fact that she had been in psychotropics for her schizophrenia for many years. Okay, other medications, steroids would certainly do it. That has been known for a long time. Anybody who's on like chronic prednisone for any autoimmune disorder, they can certainly have decreased bone density. The issue with the birth control pills, I've mainly seen just increased risk for blood clotting disorders. I haven't come across yet, at least not yet, in terms of decreasing bone density, although that could certainly play a role in there though. Now, for hormone replacement therapy, let's say, should somebody and a woman be in hormone replacement therapy after menopause? That's a very touchy subject, and I tend not to go into it because there are certainly some benefits, but most definitely there are some risks, including the risk of increased incidence of certain cancers. And so that's kind of a subject that I tend to leave to the endocrinologist, in terms of hormone replacement therapy. The most common medications that I see that relate to poor bone health or to poor tendons, leading to tendon ruptures, that we see in the clinic all the time are probably the PPIs, the proton pump inhibitors. Those are your antacids like omeprazole, and those that will inhibit the acid formation in the stomach. And people take them for acid reflux. But if you look carefully at the label, it will usually say you shouldn't take them more than 2 weeks. But many of these patients take them ubiquitously. They take it for years. Their doctors prescribe them for years. And I also had a patient with a hip fracture who was active. He would ride horses. He was a cattle farmer. And the only risk factor that I saw for this, for this osteopenic hip fracture was the fact that he had been taking the proton pump inhibitors, antacids, for years. And it wasn't even his first fracture, osteopenic fracture. He already had the other fracture fixed about 2 years prior. And but I see this all the time, where almost all of the hip fracture patients I see at the hospital are on these antacids at home. Another medication that also leads to orthopedic issues, particularly for like tendon ruptures and tendinopathies, just diseased tendons, are the statins, the cholesterol lowering medications, simvastatin, atorvastatin, those the HMG-CoA reductase inhibitors, but that we know them as the statins. They also lead to tendon ruptures and to tendinopathy, particularly Achilles tendon or the distal biceps. But I think they're also probably related to the rotator cuff of the shoulder too, because those we see all the time. And I particularly see more rotator cuff tears in patients who are like middle age, who have metabolic syndrome, they have the central obesity. Many of them are type 2 diabetic. They have issues with cholesterol and they're on cholesterol lowering medications like statins. But it's so common to see this that it's almost like we don't even make the connection. But it has been described by observational studies. It has been described by mechanism, by basic science, how the statins can lead to tendon ruptures.